all agree that the gap in the healthcare situation between the developed and developing worlds in terms of facilities, service delivery, and interprofessional relationships is vast. The sector in Nigeria has had more than its fair share of negative drama. If the different departments that make up the sector are not at each other's throats over salaries and allowances, there's sure to be a squabble over conditions of service or some administrative concern. Today, we'll be looking at the challenges of the health sector in Nigeria, and experts will be sharing their thoughts on how to meet those challenges for a more vibrant health sector. Welcome to The Big Story. I am Mary Alale Yusuf. The National Association of Resident Doctors embarked on a warning strike in June of 2016. This was escalated to a full-blown strike in July, a far cry from the number of times they downed tools between 2014 and 2016. But they say it's just the calm before the storm. They explained that they wanted to give a grace period to the new government at the time to study the situation and come up with solutions to the plight in the health sector, and also in consideration of what the government must be passing through due to the economic recession. They do not think that their long wait has produced much results. A casual conversation with any of these doctors who are on their way to being consultants, which centers on conditions of work, will inevitably open the Pandora's box.
If you say, okay, you want to train some people, maybe cardiologists and all those things, some special area, you can bring people to come and do the training. So there are some areas that it will be possible to do that. But there are some subspecialties that it may be difficult because we don't really have the facility. So we may import the manpower, but which equipment or facility are they going to use to do the training?
Probably in the 1980s and the 1970s, if you were a healthcare practitioner, you were in Nigeria, you probably didn't know what was happening in the UK, you probably didn't know what was happening in the US. You were probably practicing at the African level. But we've gotten to a situation now where with social media, with the internet, with things like telemedicine, if I'm a surgeon, for example, I know the best surgical skills that are out there. I know the best surgical methods that are out there. And ideally, I should be able to give those same benefits to patients in Nigeria.
They claim that whenever they down tools, owing to the federal government not meeting its end of agreements, they are lured back with promises which are eventually implemented selectively, leaving the sector in a confused state of half-satisfied and dissatisfied workers.
The reasons why we went on strike, some of them are still there and are still lingering in terms of poor working conditions, as regards even the IPPIS, as regards even issue of pensions, as regards issues of remuneration. Of course, some of these issues are still there, even communication. We've talked about hospital having effective communication network, effective record system for people who travel outside the country. I'm sure they are very much familiar with things like this.
Other problems came up with the universal payment method called IPPIS, a computerized program designed to plug leakages in the payment system and ferret out ghost workers. Doctors insist it consistently came up with errors. Most of those entrusted with the care of a patient are not against privatization of some hospital services. They only take issue with the manner in which it is carried out. All health personnel, physicians and other services agree on some issues. One of them is that there is no going forward without implementation of the National Health Act, and training of workers is sacrosanct. In 2001, African leaders agreed at a conference in Abuja to commit 15% of their annual national budget to fund the health sector with a view to universal health coverage for their citizens. 15 years on, this group of health workers say the Nigerian government has not walked the talk. They have organized this road walk in Abuja to mark the 2016 Universal Health Coverage Day and to raise awareness of the need for government to implement the 2001 Abuja Declaration.
It was in this same Abuja, around this secretariat, that 15 years ago, African leaders committed to 15% of their budget for health. Of the about 6 to 8 countries who have achieved that, most of them have lower GDPs and are poorer than Nigeria. So it's not a function of wealth, it's a function of the political will.
According to the health workers, the current dwindling national revenue is not an excuse for the government not to fund the sector adequately.
If Rwanda can give universal health coverage to their country, to their people, I don't see why Nigeria cannot give universal health coverage to its people. If countries like Burundi and all those things could do it, why don't they see why we cannot do it? So the thing is just requires resolve, it requires commitment, it requires orientation, prioritizing, giving the right things first.
We have all come out today to plead and beg Mr. President to do all that he can using the available legal instruments and every other thing. The Abuja Declaration, the National Health Act, every other policy instrument to make sure that in 2017 and beyond, no Nigerian will suffer financial hardship just because that person is ill and is looking for health care delivery.
They further advise Nigerians to be proactive about their health, not bothering to wait on the government if they have the capacity.
Every Nigerian, wherever you are, it's your responsibility to demand for health. It's also your responsibility to contribute towards health. If you're earning a living, you should get health insurance.
Out of the federal government's over 6 trillion naira budget for this year, 221.7 billion naira was earmarked to fund the health sector. Some of the protesters say the reality in the health sector is a far cry from what the government claims to have spent. The National Health Insurance Scheme says Nigeria is lagging behind with poor national enrollment of the universal health coverage. This is